And welcome back to the morning show. Here we are, Mohave Skin and Cancer. No, I didn't get this done yet. I haven't had a chance to get back in here, but I'm going to very soon. But we certainly have Dr. Bellew to chat with us, and this time a little bit more about the skin cancer, which is very dangerous and it's breaking out.
Good to see you, Bruce. Yeah.
Thank you.
So I just want to kind of touch in on, last week we talked a little bit about the benign skin lesions, the lesions that are not harmful to you. So I kind of want to just touch maybe today on some things that you want to look for skin cancer, some kind of tipping point signs that you'll see that can tell you, hey, you need to go and get this checked or not. I guess the biggest one I would probably want to go into is malignant melanoma, which is probably the most deadly of skin cancers. It's not the most common one, but it's one that affects the widest range of age groups. Okay. So all the way up from teenagers all the way up to the elderly, we have diagnosed melanomas, and in the segment of we talked about last week, the young females, 15 to 29 years old age group, is the fastest rising group of melanoma in this country. And so a couple features you want to look out for. So usually melanoma arises from a mole, and this is either a mole that you've had since you were born, or this is a mole that develops new. And typically it's a genetically programmed lesion in that your family history plays some role here. But a lot of it has to do with environment. So how many sunburns you had before age 20? What did you do for work? Were you a gentleman that worked outside, let's say on pools, and you were outside all the time? Or you worked as an electrician and you were outside all the time? So jobs that have an occupation where you're going to be outdoors are much more prone to skin cancer than, say, people that are inside in a desk job. Okay. So those people that spent their years working outdoors probably should be checked more often. But melanoma's key feature is it's usually a mole that changes. Most moles should be perfectly round and circular. Okay. They should not have any atypical shape to them. You look at a jigsaw puzzle and you'll see the different shapes to these pieces, right? Right. A melanoma usually shares those features. It does not grow in a uniform fashion, meaning it's not going to grow perfectly circular. It's going to have that haphazard look to it. It's going to look very atypical, very irregular. And typically within that irregular mole, you'll see different colors. So usually black will be intermixed with red and tan. So that's another big feature. When we talk about size of a melanoma, the size really, to me, is not a really big component. A lot of people think that melanomas have to be big. I've seen them as small as 2 millimeters, which is really, really small. A pencil eraser is about 6 millimeters. Wow. And that's kind of the cutoff that we look for. But again, you can see them smaller than that. So to me, when you're looking at a mole, the biggest thing you want to make sure is it uniformly round, and is it uniform in its color? And if it's not, it should be checked. Okay, that's bottom line on that. Now, when a person comes in and you find a mole of irregular size, sure, and you say, okay, you know what, that looks a little suspicious. Right. There's no magic crystal ball here that we can look at. You go ahead and you remove that and the skin around it. Am I correct? Correct. So typically on a mole that we suspect is suspicious, what we would want to do is actually remove the entire mole and a little bit of the good skin around it, and then we usually take that down to the layer where we feel that the mole, the cells are going to be basically present. Contained. Correct. And so we want to remove a good amount of that mole so that the pathologist who's got to read our tissue slide is going to have enough tissue to say, okay, is this a skin cancer, number one, and number two, did you get it all out? So on most of my patients that I remove moles, I don't do what's called a shave biopsy, meaning I don't just take off that top layer. I actually like to excise it in a football-shaped manner down to the level where I feel like I get all the cells out, and I usually will sew that up. Now he's using his hands to express to you the way that it all goes, but we're talking tiny, okay? So yes, don't get too excited about it. Exactly. Not taking your arm These are, we're talking about, millimeters to centimeters in size. We're not talking about inches. We're talking about very small cuts. And usually on a patient's mole that I'm not sure whether this is a melanoma or it's just a normal mole, I will just take a small cut. Now, if it turns out that the skin biopsy comes back showing as a melanoma, then we usually have to do a wider cut. And that's based on the depth of the melanoma and the grade and the stage at which it's at in the skin. And that all guides whether we do that in the office or we have to send our patients to either a surgeon in a hospital to do that. And that's why it's so important to get that checked early, because if you get it at an early stage, we do it all in the office. Right. Whereas if it's done in a hospital setting, it's a very deep melanoma. Usually they have to check lymph nodes. You have to be under a general anesthetic. You have to be, the recovery is a lot different. The scarring is a lot bigger. So it's so imperative to get this at the early stage so that you don't have to go to that step to the hospital. Lymph node checks, all these things that can cause a lot of problems later on.
This isn't one of those things where you have to come down here and then wait for the phone call, come back in a week, come back down here. They do it all right here. You've got a lab right here.
Exactly. So we like to do these, especially for melanomas, we like to basically remove them right off the bat. So we're not going to really bring you back. Now, some insurances do require that we get authorization for a lot of these things, but usually when I see a melanoma in the office, and I'm sure it's a melanoma, I will try to get basically a stat authorization with the patient's insurance so we can hopefully do it that day or that week, because again, we don't really want to wait or delay on these things.
Right.
So
99% of the time you can get it done right here, and they'll go ahead, they'll check it in their lab and make sure they've got everything. If they've got everything great, bandaged up, you're ready to go. Otherwise, they bring you back in. They've got dyes. They've got a really kind of unique way of doing this. I've seen it done, and they just make sure they've got everything out of there. And then when you walk out of here, you are free from that melanoma.
exactly.
So, do not be foolish. And if you've got something like that, and have your partner, if you got a partner, have them look at your back and make sure that those moles aren't moving around in any great size to them or weird shapes, because that's the first sign of bad things to come.
Yeah, and I'll point out just really quickly that
Sure.
the back for men is the most common site for melanoma,
Okay.
whereas the thigh or the lower leg is the most common for women. It doesn't always follow that pattern, but it just tells us that for a lot of married men, these are the guys that need to be checked by their spouses and check each other's backs once a week, or sorry, once a month probably. Once a week is probably too much, but once a month
Depends
just
on
to
how long
make.
you've been married.
Sure, that's right. But in general, once a month is usually a good time frame to see if something is new that's popping up on the skin.
Right.
And if it's something that you're questioning at all, it just takes a simple trip down here for us to take a look at it and make sure it's okay.
Mohave Skin and Cancer, ladies and gentlemen, come on down, check them out. Give them a call first, get your appointment, come down. Two great locations right here in the tri-state. Well, there's several in the tri-state, but right here we've got Laughlin, and then there's also the newest one over in Bullhead City on Riverview Drive. So you have, no, that's on, it's in Riverview Mall on Marina. That's what it is. Why they named those two, I don't know. Anyway, we'll be back with more of the morning show right after this. Thank you, Doctor.
Thanks for having me.